Okay, I am so excited to talk to you. And I know we were just talking a minute ago. Like when you put nutrition stuff out into the void, it's so rare that you find someone who you're like, oh, I agree with everything you are saying right now. So I'm really excited to share your work with the Allsorts community.
Desiree, I'm so happy to be here. And I was actually just talking to a friend before this recording about how I feel like I stumbled across your Instagram like a little over a year ago and was like, that's a kindred spirit. Like we're saying a lot of the same stuff, and it's just such a joy to be here and to be chatting and connecting with you.
I always love asking dietitians because I feel, especially now that I have kids, like when we're children, there's a very small set of professions we are taught exist. We're like doctor, like nurse, like firefighter. And I didn't even know what a dietitian was until I went into nutrition at university. So, like, what inspired you to be a dietitian?
It's so funny that you mentioned that. Like when I have a very distinct memory of when I was a child, we had this like exercise we had to do where you're supposed to draw the career that you see yourself as in the future. And I drew three things. You're supposed to pick one, obviously. And how can you ask a child to pick one thing? That's crazy. But a doctor was obviously in there with the stethoscope slash lawyer was in there. And now I work in dietetics, and I've worked in research for a long time and also still work in the realm of food policy. So I feel like somehow it's like kind of shaped into that area. But my path to become a dietitian was not, it wasn't, I didn't set out to become a dietitian. I knew that I was really passionate about science to begin with. And when I was in undergrad, I studied neuroscience and psychology, and I was really kind of debating whether or not I wanted to go the research route or whether I wanted to go kind of the clinical route. So I was dabbling in both, and I was on the pre med track, but the time that I was doing my undergraduate, I was also working at the Duke University Medical Center studying neuropharmacology, working in a lab there. And I got really interested in the gut brain axis. And this was this was a long time ago now.
Before everyone started talking about gut brain stuff.
Yeah, I guess so. I mean, and it's just crazy to think about how time has just flown. I mean, when I think about like university, I'm like, was it really that long ago? But it really was. um, but yeah, we were looking at the effectiveness of SSRIs, so medications for major depressive disorder, depending on the gut-brain axis. So if there were alterations in different biochemical pathways that are modulated by the gut brain axis, does that change the way that SSRIs work? Does it make them more or less effective? So I started getting really interested in that topic, and I just had so many questions. So I knew that I wanted to kind of explore that topic one way or another. And after I graduated from undergrad, I actually went on to work in clinical research, not necessarily in neuro, even though that was kind of the direction I was longer term heading to get to at the time, but in diabetes management. So I
Mm.
was working on a global study portfolio for artificial pancreas studies, and it was super fascinating. I learned so much about the whole research process, but during that time I got really exposed to the power of nutrition, obviously, in the management of diabetes. And so I started kind of learning a little bit more, reading a little bit more, and realizing that the piece that was missing for me was that one-to-one impact. And I think the thing that I'm constantly trying to bridge, and I'm sure that you can relate to this since you're also doing so many different things, is I want to have that one-to-one impact and be able to chat with people and really get in depth with them, and also have impact at scale. So how can we do both of those things? And I learned more about kind of the opportunities for me to get back into that clinical world, and becoming a dietitian really stood out to me because there's so much that you can do as a dietitian across sectors in the food system, that I was like, man, there's so many opportunities for individual and scale impact. So that's really kind of what drew me in the space.
That's incredible. And it's so interesting because I too went into nutrition because I was interested in medicine. And I was
Yeah.
like, well, nutrition is such an important part of keeping people well. And they don't do any nutrition in med school. So I'll get a nutrition degree as a background. And it was very much like, wait, what is this dietitian thing? Wait, like dietitians sit down with people for like a whole hour and like talk about, I was like, I feel like a lot of what I would have dreamt of doing as a physician, because I was interested in sort of the like integrative side of things. I was like, I feel like I can do this as a dietitian. I
Mhm,
might actually give
mhm.
this a go.
Yeah, yeah, same, like, almost exactly the same kind of experience, yeah.
And incredible that you have that background in neuroscience, because particularly like, and we're going to talk today about SIBO, but like, I find that there is no sort of like greater and more interesting like connection in the body, like, than the gut with the nervous system and the immune system. Like, I just feel like gut health and digestive conditions are the most like, I'm very biased. I feel like this is the most fascinating area of nutrition. And having that background on like how the nervous system actually functions would just give you a whole different perspective on this.
Yeah, I'm right there with you on that bias. I am so I'm so biased. I think that the GI system and the gut brain axis is so fascinating. And I mean, what drew me to neuroscience to begin with is that it's such a young science. There's so many more questions than there are answers in the space, that it's a really exciting place to be in research, in science, in medical care. And the more and more that we learn about the connection between the gut and the brain, the more that we are able to actually use specific language, measures, interventions for things that we kind of intuitively know to be there, right? I mean, like, for a lot of us, when we get super nervous before like public speaking gig or before a big exam, like, you can feel a change in your gut, right? I mean, most of us have had an experience that we can point back to in our lives where we can say, ooh, yeah, I had some kind of psychological experience and it was linked to some kind of physical experience that I have, but we lack the precision of language to be able to describe exactly what it is going on and the mechanisms that are underlying that. So having that, I think, grounding in neuroscience and psychology, it just it makes me such a big nerd. Right? It makes me constantly so excited about like all of these topics. I've got my RSS feeds, which are like these little notifications that you can get straight out of PubMed, which is a research database of like any new gut brain study that comes out. And it's like I'm just eating that stuff up. So it's great. I mean, it really does help also, in my perspective, to validate patient experiences. Because a lot of the time, again, it's like we can feel something to be real, and patients, unfortunately, GI patients are very often encountered with experiences where they might not necessarily feel validated if they're having some kind of emotional psychological experience that's tied with GI symptoms. Sometimes those can kind of just get not like pushed to the side, but just kind of like, oh yeah, well, stress does that, like, just manage your stress. And we know that stress obviously plays a role, but like, what GI patient wants to be told, just manage your stress? Like, give me more than that. Help me understand what's going on, right? I can see you're like,
Well, and
yes.
just the idea and it, that it is sort of used as a dismissal, because it's like, if that
Yeah,
were so easy, wouldn't we all be doing it right now? You know?
right.
And I think the very real understanding that while it's not all in your head, like, stress is producing physiological changes in how your digestive tract is operating. And like, particularly because in our space, there are so many people who instantly, oh, it's food. Right?
Mhm.
So, "Oh, I'm not gonna eat this." Like, I'm gonna go on the internet and see who's telling me to eliminate what, and I'm gonna eliminate it because it has to be something that I ate, as opposed to being like, "Oh, this stress could actually be creating these changes, and yes, I'm having these symptoms around mealtime, but
Yeah.
it's not the meal itself that's leading me to do this." And it's, I think when you have a really good understanding of that gut brain side of things through working with a practitioner like you, it just it allows you to start to think, "Oh, hey, my body's telling me something right now," like, 'cause there's this very, like, me versus my gut thing that happens in
Oh,
digestive
yeah.
health, and, like, you'd be like, "Oh." Oh, no, no, I'm getting a signal here. Okay, so what's my body trying to tell me? Like, what do I need to understand right now as opposed to that fear that is instantly like, I did something wrong. No, you didn't do anything wrong. Your body's just
Yeah.
going through something right now.
Yeah, absolutely. I love the point that you bring up about like you become almost combative with your body, or it's me versus my body. And I think that part of the major mental shift or the mindset shift that has to happen for any person who's struggling with a chronic gastrointestinal condition is how can I find ways to harmonize with my body, to support my body, get on the same page between my
Yeah,
mind and my body. And it is like such a rewarding process and it takes time. And I think that specifically the part about it taking time and giving our body and our mind some time to reharmonize and reconnect and get back in touch with different physiological cues, psychological cues is really the key. And so yeah, there's so many things out there on social media that kind of encourage us to go look for the panacea, the pill that's going to fix it all. And it just it doesn't work that way.
I
It
know.
doesn't work that way.
Like how people actually search on Google for like, how can I fix my IBS in 1 day?
Yeah, right,
And you're like,
exactly.
it took a lot longer than 1 day for this situation to happen. It's going to take a lot longer for one. And you can live it. Like I live with it. I
Yeah.
live with it. I've had it for over a decade and I'm very lucky because it rarely impacts my life. Like actually in the last couple of weeks, which was very much like a hangover from finishing my book manuscript, I was like,
Yeah.
"Oh, oh, okay. I see you. Okay, I know
Yeah.
what's going on here."
There you are. Nice to see you
Yeah.
again.
I'm like, "Oh, okay."
Yeah, yeah.
But
Yeah.
I wanna talk I'm so excited to talk to you about SIBO or small intestinal bacterial overgrowth because I think particularly when we're talking about what's happening online and a lot of very confusing and misinforming things are happening online, specifically around SIBO, and I'm wondering if we can start by just saying, like, what actually is it? Because I feel like people don't really know so much.
Yeah, it's a great question. And I'm so happy to be having this conversation with you because I'm sure all of your listeners, and I'm sure you see this too, but there tend to be like conditions du jour, like the ones that are the most popularly talked about or like self-diagnosed on social media. And I'm not judging because I've been there like 10 years ago and I was like, what is going on with my gut? Like, I really need to figure this out. I was like, maybe it's gluten intolerance. That was what it was at the time. Like everybody was
Totally.
suddenly intolerant to gluten. And now that condition is SIBO. And like you mentioned, SIBO is an acronym that stands for small intestinal bacterial overgrowth. And I think what gets confusing for people there is the term maybe overgrowth. um, so the best source, or one of the best sources that you can find out there for defining these kinds of terms, is something called the American College of Gastroenterology, or at least that's one of them. There's plenty of them depending on where you live. And they define SIBO as an excessive microbial burden that resides in the small intestine when those microbes should actually be residing in the large intestine. So really, there's a microbial party going on in your colon, and that's where the party should be. But the party has spilled out onto the street, and now it's happening somewhere where it's not supposed to be. So it's not that you have an infection of a particular, pathogenic or bad disease causing bacteria or microbe. It's that they're hanging out where they shouldn't be and they're multiplying where they shouldn't be, or at least not in the numbers that they should be. And so that's kind of presenting in some symptoms and some discomfort for you. And then another important part of this definition of SIBO is that in order for it to actually be classified as SIBO, it has to be measurable in some way, which we're going to talk about, I'm sure, because the ways we measure SIBO are very imperfect. And it also has to be associated with a clinical presentation, which is a fancy way of saying it's actually impacting your day-to-day life. You're feeling symptomatic. Maybe you're super bloated. You could be having new abdominal pain, excessive flatulence, changes to your bowel habits, those kinds of things.
Yeah. I love the way that you described it because I think people are really confused. Like instantly people are like, it's a candida overgrowth. Like, damn it. No, it's not
No.
candida. Because like these are bacteria that do belong in your gut. It's just that they belong lower down in your gut. And then something
Yeah.
has happened to allow them, I love that, to spill out onto the street of the small intestine. Like it's annoying the neighbors. They shouldn't
Yep.
be there. They're too loud.
Exactly. Exactly, right? They're just not where they're supposed to be. It's not necessarily that they're quote unquote bad guys, but they're just not where they're supposed to be. They're multiplying, and in the process of multiplying, they're also breaking down foods before they get to the colon. They're fermenting, they're increasing gas, discomfort, water draw. So I think I might be jumping ahead a little bit, but it is for anybody who has SIBO very uncomfortable. And you'll know you'll know something like that is going on.
Well, and I love that because, that, and I just posted something on Instagram this morning about like, is it IBS? Because I think that IBS, particularly if, people are getting sort of like quote unquote diagnosed by their GP, they're like, yeah, you're hitting all these like symptom criteria, it's IBS. Whereas there are a lot of things that produce the same symptoms like SIBO.
Yeah.
So, and by definition, SIBO is about the small intestine, not the large intestine, which is really what we're talking about, with respect to bacteria in irritable bowel syndrome.
Yeah.
Um, and so it's like, how do you know which one is which? And I love Kate Scarlatta. For anyone who's listening who doesn't know, Kate Scarlatta is like sort of the preeminent like IBS dietitian in the US. Like she was the one teaching all of us. We were like,
Yes.
what about IBS? We learned from Kate. So, and I love the way that she described SIBO because she was like, it's like IBS on steroids. Like these are
Yes.
very intense symptoms. And so if you're like, oh, like I like wandered into the naturopath feeling like, okay, a little sluggish. And then they told me I have SIBO. It's like, no, no, like definitely not. Like you have
Mhm.
to have that presentation. So like, so what does that look like? Like what are the symptoms of
Yeah.
SIBO?
Yeah. Well, so the number one most common symptom with SIBO is excessive abdominal bloating with distension. So I think a really important part of this conversation is being able to, again, add in that precision of language, especially when we're talking with our care team and our clinicians about, what's the difference between bloating versus distension. So bloating is a subjective experience that you can feel like your discomfort in your abdomen. It can be anywhere along your abdomen, but you're feeling uncomfortable. You can be bloated without being distended. However, if you are distended, there is an actual measurable increase in the outward protrusion of your abdomen. So when you tell a clinician that you're feeling bloated, it doesn't actually necessarily communicate the same thing as if you're bloated and distended. If you are both, that kind of communicates something else. And that might lead to a deeper conversation about, okay, well, do you wake up distended? Do you only feel distended a few hours after eating a meal? How soon after eating a meal are you feeling that distension come on? And those kinds of questions are really important in determining what the next steps might be in your diagnostic process. So bloating is really the number one most common symptom with distension. And then also alterations in bowel habits. So diarrhea is a very, very common symptom in SIBO. Constipation is a very, very common symptom in SIBO as well. I'm gonna add the asterisks now about SIBO and EBO. Okay, so for those of you who are familiar with SIBO already, we've kind of chatted a little bit about it, but the reason that the definition for SIBO is an excessive microbial burden in the small intestines is that it actually also includes an excess growth of non-bacteria. So SIBO specifically refers to an overgrowth of bacteria in the small intestine, but there is recently, I think as of a couple of years ago, a new diagnosis for something called intestinal methanogen overgrowth, which was previously kind of in the SIBO bucket, but that's really the more constipation predominant type of SIBO that occurs as a result of an overgrowth of not bacteria, but something called methanogens, which are in a totally separate kingdom. You have your bacteria kingdom, and then you have archaea. Methanogens hang out in the archaea camp. So Just in case you ever hear or see the term IMO or emo, we're talking about that.
As soon as we bring up Archaea, I just get very, very excited and nerdy.
I know.
It's just like, tell me more about methanogens. And
I know.
yeah, and it's so interesting, and I will jump and try not to confuse everyone listening, but like I find methanogens so interesting because so often in our practice, we would get them in chunks too. We would get these chunks of folks with irritable bowel syndrome with constipation. And we're like, these people don't have true IBS-C. They're like just really constipated for years. And like we fix the constipation and it goes away. And then for folks who have true IBS-C, like this idea that like no matter how much water, no matter how much fiber,
Mhm,
no matter that they do all the things right, like the gut is just not moving. And it's these methanogens,
mhm.
and so folks are really, yeah, they can be like, "Oh, well, what do you do? Like, do you take a probiotic?" We're like, "Well, probiotic's not gonna do much for methanogen." Like, like you gotta kill those suckers. You gotta get them out of your body to make this better.
Absolutely. Yeah. No, I my gosh, we should have an entire thing just about emo slash methanogens. I don't even know. People are like, these guys are nerds. But yeah, no, the methane gas that they produce can actually slow down gut motility, which is obviously the speed of contents moving through your digestive tract. So when you have an overgrowth of those particular types of microbes and they're producing a lot of methane gas, you're going to be a little bit more constipated. Things are going to feel more slowed down. And exactly like you mentioned, the reason that we bring up that there is a difference between SIBO and EMO or IMO is that it changes the appropriate treatment protocol as we know it to be now. So it is important to know those differences. And another reason why, even though the diagnostic methods right now are imperfect, it's still kind of a good idea to figure out what kind of overgrowth you're looking at when you can.
Totally. So let's talk about diagnosis. Like, how are people getting diagnosed? And I will say for my listeners in Canada, so what you're going to hear now is going to be different than what's available in Canada because, unfortunately, at least here on the West Coast, I get very frustrated about how gastroenterologists are willing to test patients in order to get a better differential diagnosis. But that's neither here nor there. I want to hear from you about, like, let's talk about
Oh, you're all
diagnosing.
about that. Oh my God, my like health policy brain is tingling. I want to know what's going on. Okay, well, we'll have an offline conversation about that.
Yeah,
Okay, so the diagnostic process for SIBO is and EMO is so, I will say, just to ground this, it is highly imperfect. The options that we have available to us are either highly invasive but pretty accurate, or non-invasive and a lot of false positives, meaning people would be diagnosed when they don't actually have SIBO or EMO. So to kind of go back on that, the very accurate but highly invasive option is called a small bowel aspirate, and it actually involves taking a sample of fluid in the small intestine, usually around the jejunum, to see what kind of bacteria are hanging out in there. And there's a lot that's problematic about that as well, because you're only collecting a small sample from a very particular part of the small bowel. Well, what if that's not where the overgrowth is, or we're really getting an accurate representation, yada, yada. But that is considered the gold standard diagnostic method where you can really say, okay, this person has a bacterial overgrowth or a methanogen overgrowth. The option that is much more accessible, still not totally accessible, still not totally affordable, is called a breath test. And that is when you actually measure the types of gases and the quantity of gases that are produced in a certain time period after you're exposed to a particular types of carbohydrates. And so that can tell you if you're producing an excess of hydrogen or methane. And there are some new tests that are testing for hydrogen sulfide as well. So there's a few different types of gases that we're kind of looking at when we're diagnosing SIBO. The downside there is that with those breath tests, a lot of things can go wrong in the actual prep for the test. So there's a specific eating pattern that you have to follow in like the 24 to 48 hour period prior to doing the breath test, which let me tell you is so bland and so boring and so hard to stick to. So people struggle with the prep. Next, it's hard to just collect the sample because most people are getting home kits and they're doing breath tests at home, and it's not exactly the easiest thing to do. So that's another piece. And then finally, the actual analysis. We know that there are a considerable proportion of false positives that come out of these breath tests. So it's really kind of difficult to know what the best diagnostic method is for people. And for that reason, a lot of clinicians, physicians actually prefer to treat empirically with antibiotics to try to find out if that actually helps to improve their symptoms instead of having patients have to pay out of pocket for a breath test and then also oftentimes have to pay out of pocket for a very expensive antibiotic to help treat with SIBO as well.
Yeah, and that's such a big challenge in SIBO too, because the antibiotic regime. I was talking with someone at Fancy, which for everyone listening is like the big dietitian conference, and we were talking about the antibiotics. And I was like, my gosh, like so many of my clients can't afford them because here locally, the protocol is about $600. And then
Yeah.
the dietitian was talking to me and she's like, oh gosh, where I am, it's like 3,000. And I was
Oh
like,
yeah.
okay. So,
At
you know,
that 600, and I was like, "Whoa, we're having a sale on antibiotics? Like, it's so much more expensive." It's
God bless Canadian drug prices, so, yeah.
yeah, yeah, true.
So you can see and I think, what's already evolving in this conversation for anyone listening, and I think that's why maybe what contributes to it being such a topic on, sort of like wellness spaces on Instagram and that kind of thing, like, this is highly complex. We have
Very.
very imperfect methods of diagnosis. We have very expensive treatment protocols, and so that leaves a whole bunch of people, kind of just like out of luck, right?
Yeah,
Like they can't get
totally.
access to testing, they can't afford the antimicrobials. And so it starts to be like, well, here's an alternative, like, do this instead. And like, what do we know about what is actually causing the overgrowth? Like, what's the science say about like, why does this happen? Like, how do those bacteria get from where they're really welcome to like where they're not so welcome?
Mhm. This is a great question, and this is something I think that is a really big focus of the research right now. Because there are so many people who are coming forward and they're like, these sound a lot like my symptoms, and I've done a lot of other diagnostic testing, and nobody can figure out what I have. So, do you think it could be SIBO? So, there are a couple of different categories of like conditions that are associated with the development of SIBO or emo. And just for ease, whenever I say SIBO moving forward, I'm also incorporating emo into that bucket. Okay. So there could be mechanical issues. So there could actually be like a physiologic barrier that's making it so that bowel contents are not moving smoothly or effectively through the small intestines, through the colon, and excreted. So an example of that could be something like a small bowel tumor or like a stricture from post-surgical complications. So you'll see patients who have had a history of GI surgery may be more likely to develop SIBO, especially if that surgery impacted the something called the ileocecal valve, which is an area where your bowel contents have to kind of defy gravity and move up a little bit, right? And twist and turn, and so things can get a little bit stuck there. So you can develop um, an overgrowth if you have an issue with your IC or your ileocecal valve, or if you have a history of bowel surgery. There are other types of conditions as well, like IBS, that impact your motility. So the rate at which bowel contents move through your GI tract could be maybe a little bit too fast or maybe a little bit too slow. More often it tends to be that you have a slow motility challenge, and that's a diagnosable condition. So you might have something to look at there, maybe just improving your motility or getting your motility to a place where things are actually just moving through the gut can help you to resolve the root of your SIBO. Pelvic floor issues can also be involved. So if you have a patient who is having a lot of those very stringy, like pencil like bowel movements, who really struggle to pass a bowel movement. They never actually feel like they're emptying. Maybe they're actually going every day, so they haven't been formally diagnosed with chronic constipation or IBS-C, but they're really struggling, should definitely consider getting a pelvic floor physical therapy full assessment done to see if that could be contributing to some of their motility issues. And like 10 out of 10, integrated care is the way to go. So just shout out to all the pelvic floor physical therapists out there
Yeah,
too.
like PSA for anyone dealing with, gut health issues. It's nice to get to know your local pelvic floor physio. Like, it's amazing what they can do.
Yeah, it really is. It really is. And like the dietitian PFPT dream team is like, oh God, I love them so much. Um, you can also be taking medications that could be slowing down your digestive tract. So medications play a role, particularly things like opiates can really slow down your digestive tract. So even if you have a history of opiate use, that can contribute to increased likelihood of developing SIBO. Then you can have enzymatic issues. So you could have something called pancreatic insufficiency, which means that your pancreas is not producing the proper enzymes to help you to break down the macronutrients in your food properly, and that could be causing an absorptive issue, and that in itself can increase your likelihood of developing SIBO. So all this to say, it is a very complex condition with a lot of other complex conditions associated with it. So that is why it's so important that if you even suspect that maybe SIBO is playing a role in your symptoms, to actually go in and get assessed and get on the phone or get an appointment with somebody who is familiar with all of these conditions and can help you to navigate how to get the right care. That's, to me, I think the biggest piece that's difficult for folks, because it is a condition that is becoming more commonly understood and known and recognized in the GI world, but you'll still encounter some GI doctors who say that SIBO is not even a real diagnosis, that it's not a real thing, right? So yeah.
Yeah, and that's the hardest thing in gut stuff, and I think, I have so much respect for physicians because they have such an incredibly complex job to do at the best of times, and then when we're talking GI, it's just so incredibly challenging, and so it's really important for us as, like, patients to advocate for our care. Like, we really have to be bold enough to be like, "Look, I understand that there are so many different reasons why this might be happening. Like, are you doing the tests necessary? Like, are we really sort of like, cleaning every corner, like every baseboard to make sure we really understand what's happening in my body, particularly if you've gone down a therapeutic line or a treatment line and you're not feeling better."
Yeah.
Um, yeah, I find, and I want to shift to nutrition a little bit because so many things that you said had nothing to do with what you're eating.
Yes.
And I just want us to pause and think about that for a moment because overwhelmingly, the advice on SIBO is cut out 75 things and your SIBO will go away. But if motility, like if your gut's not moving, and we forget that, like the gut is meant to move. Like not only does it help the food move down the digestive tract in the appropriate way, so we have enough time to digest and absorb everything we need. Like that's super important. But also as those waves sweep through the gut, they're sweeping undigested food. They're sweeping unnecessary microbes through and out the gut too. If you mess with that, like it's not just going to be go gluten free and bye bye SIBO. Like that's just not how it works.
Yep. Absolutely. Yeah. I think you've probably seen this a lot, but one of the most common nutrition recommendations that I see in for patients with SIBO or who suspect they have SIBO is to cut out all plant foods, all like, and just have meat and things that you can tolerate well. And I think that there's even like you can't have dairy, but you can have like actual just like chicken and eggs and red meat. And that can maybe help people feel better, but that is not actually going to be addressing the problem. And you're going to put yourself at risk for other nutrition deficiencies, other issues, potentially exacerbated motility issues because you're no longer getting that fiber that you need in your diet, increased risk of cardiac issues. So, yeah, there is a lot of really I think well-intentioned but bad advice out there for patients with SIBO in particular and with GI conditions in general, right? So one thing that we do know that's a symptom or a manifestation that's in common with IBS and SIBO is that it is common to develop a carbohydrate intolerance, or maybe not even a true intolerance, but you might feel really uncomfortable after you have something that's super fibrous. And again, that comes down to understanding what's going on physiologically in your body. It's because you've got microbes that aren't hanging out in the right neighborhood. They've moved up, to closer to where your belly button is, so around your belly button. And as you're eating foods that contain fiber, those microbes are breaking those fibers down and they're producing gas as a byproduct. That gas is not even a bad thing, right? The gas could even have health benefits. You're getting short chain fatty acids from that gas, which has other health benefits that we want. It's the problem is that they're not where they're supposed to be. So it's not the food that you're eating that's causing those symptoms to manifest. It is really just the location of the bacteria. So in order to actually get those symptoms to come down, it doesn't matter what elimination diet you do. In fact, there is no research to substantiate which is the number one best diet for patients with SIBO. Everybody wants to know it. It's the $1 million question. But right now, the best approach is eradicate the SIBO from where it's not supposed to be and use a personalized diet approach, sometimes incorporating elements of a low FODMAP protocol to help minimize that fermentation and the symptoms that people are experiencing to make you comfortable during your treatment, and then really focus on all of the other nutrition and lifestyle variables to help you rebuild your gut microbiome after exposure to antibiotics.
And this is such a critical distinction to make because we have this conversation with folks all the time, particularly for people with Crohn's disease, ulcerative colitis, like they'll come to us on a very low residue, low fiber,
Mhm.
like white bread and chicken and like, Red Bull. Honestly, there's so much Red Bull that I
There's so much
find
Red
from like
Bull. You're right.
from like gut health. I'm like, why all the well, you're exhausted. I mean, I understand that the inflammation is exhausting. And so having this conversation that your symptoms are triggered around the ingestion of food, but they are not the cause
Mhm.
of the symptoms themselves, like it's not that carbohydrates are bad. They're very, very good when the bacteria are where they're supposed to be and doing the right thing. And so low FODMAP isn't the therapeutic diet for SIBO. It makes you comfortable while we work on what's really happening here, which is like getting those bacteria where they shouldn't be.
Exactly. That's exactly right, and so well said, Desiree. That's exactly it.
Well, let's talk about like motility a little bit because, for us as dietitians, like often like physicians can use pro motility agents. There are medications that will help with motility. But like as dietitians, like what strategies do you use to encourage better motility in your clients?
Yeah. Well, first I will say, because I see a lot of this too, that like it is okay if you need to use medications, like real medications, pharmacologic agents to help you get past this very uncomfortable phase. Yeah, I feel like there is like a lot of medication shaming out there in social media land, and I just for anybody who's feeling like, oh, I can't do that, I have to just use like herbs, whatever. We can try with those methods, absolutely. But if you do end up needing to take something like a prokinetic, that's great. That's fine too. Whatever helps you to get past that phase. And maybe it's not even a forever thing. Maybe it's just a temporary thing. And that is really a good time where we can, our physicians are doing everything that they can to help get us that comfort and to help get us over that hurdle. So if you've been feeling that or encountering anything that makes you think you have to go the all natural route, it really is up to you which route it is that you go. And with that said, there are some nutrition strategies and lifestyle strategies that we can try out to help to boost your motility. So, one of the first things, and this is not on the nutrition side necessarily, but movement, actual physical body movement is a really big one because we don't think too much when we're in our day to day lives all the time about how much I'm actually getting up and moving, going on walks, or maybe the type of movement. I've had actually a lot of SIBO patients who are highly active, but they're doing exercises like high intensity interval training, and they're doing like a lot of cardio, a lot of sprints, a lot of Pilates and those kinds of things. And maybe they're dealing with a pelvic floor issue that's contributing to their motility slowing down, or them not being able to have regular bowel movements. Sometimes just changing what kind of movement you're doing to be a little bit more gentle, a little bit slower, a little bit lower impact can really help to get things going. It can also be the opposite. It can be that maybe you would benefit from a little bit more high intensity exercise. And again, this is why it comes down so much to personalization with stuff like SIBO, GI conditions in general, to figure out how do we modify your movement. That's a really good first place to start. And honestly, one of the most all-star movement strategies, and you tell me if this you've seen this too, a walk. Just a
Yes.
daily walk, 20, 30 minutes if you can. Doesn't even have to be all at one time. If you can spread it out throughout the day, or better yet, you can start the day with a nice walk outside, get some sunlight, get your body moving. That can really help to get your bowel contents moving as well. So, another thing that we can try from the physical side of things is like an abdominal massage. Some people really do benefit enormously from something called the ILU massage, which can is essentially a colon massage. So you're following along the shape of your colon and you're massaging like an upside down U shape and helping to get the bowel contents moving that way. And even that can be enough physical stimulation for some people. Or maybe it's a combination of a walk and doing that massage. That kind of thing can help. And then from the nutrition side of things, this is where it gets kind of fun, right? Because first we need to figure out what's the underlying cause, the situation that we're looking at that's contributing to your SIBO. If you have a ton of backed up stool and you've got SIBO, and then someone says, okay, now go pound fiber.
Well, it's the worst day ever.
It's gonna be a really bad day. And unfortunately, like a lot of times, the first line thing that we'll get is a handout that says, just drink more water, which drinking more water is usually a pretty good thing. Most of us are probably not drinking enough water, so it's not a bad place to start. But adding fiber when you're already constipated might not be the best move. Really depends on the type of fiber, it depends on how much backup stool you have in your intestines. So we would first have to kind of just see, like, can we try to get things moving a little bit? Can we try to clear some of that backed up stool? A lot of times I see patients who say that they're struggling with diarrhea, but what's really going on is actually constipation, right? They're having some overflow diarrhea, which is fermented stool that's backed up behind stool that's kind of been hanging out in the intestines for too long. That's fermenting, and you're eventually having diarrhea, then you're feeling constipated again. So that's a really tricky place for patients to be, right? But can we get some stool to clear? For some people, fresh ginger can be really helpful. So that is one of the only herbal and non-stimulant herbal interventions that you can try to help support your motility. 500 milligrams of ginger. Don't take that as me telling you to go take 500 milligrams of ginger. Go talk to your care team before you change anything in your supplement regimen. But that can actually help in some patients sometimes as like a gentle way to kind of get things moving too.
Yeah, I love that. And it's just, again and again, like I think one of the biggest sort of themes that emerges when we talk about this is just how complicated. And this is the challenge when, like we both do, we talk to a lot of people at once on the internet because everybody is different. And just like you said, for one person it might be like, ooh, fiber is gonna work here. And for another person, you're like, oh no, fiber is the worst thing.
Yes.
It's like, how do you come up with a 60-second reel? They're like, let's talk about fiber. For some of you, this is gonna be the best idea ever. For some of you, it's gonna be the worst.
Exactly.
Surprise! I can't tell you which one you're gonna be because I'm on the internet.
Yeah, exactly, exactly. That's why it's so important to get that one-to-one care. I mean, yeah, like I just something that I wanted to mention about the fiber thing also is that not all fiber is created equal. Not all fiber is going to have the same effect in your GI tract as it would in the next person's. And even if you had the identical GI tract to somebody else, right? Yeah, and which would never happen. But even if you did, um, different fiber will impact your GI tracts differently. That's just the way that they work, right? So for somebody, a psyllium husk might be the perfect thing for their constipation, but for another person, it could do absolutely nothing. And psyllium is usually kind of the place where most people start, kind of like the OG fiber for constipation. But if you're like, really struggling with SIBO and you're feeling really gassy and bloated after you have psyllium or you have some other kind of fiber, a really good place to start is look at what kind of fiber you're having and talk to a dietitian and say, is this the right kind of fiber that I'm supposed to be having? They're all different from each other. I know it probably sounds kind of overwhelming, but that's a quick conversation with a dietitian. So highly encourage it. Highly encourage it.
Yeah, and I think, something else that's important is that this is not up to you, the listener, to figure out on your own. Like, one of the reasons why
Absolutely.
we're going into, like, talking for an hour about just how complex SIBO is because we want you to be armed with information that then you take to your healthcare practitioner. If, like,
Absolutely.
my healthcare practitioner, like, isn't really sure about this stuff, then you can be like, "Okay, so here's the information you've gathered." Then you take that to your healthcare practitioner, and that's their thing. Like, it is
Mhm.
their job to, like, take the stress off you, do the diagnostics, give you a path forward, and you follow it. I mean, that's not always easy either, but it's not the stress of like, I'm going to read 75 million blog posts and, like, 20 hours of podcasts, and then I'm going to create my own protocol. No, 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 no. Like, get the support you need. So I want to put in a little plug here because you offer programs. So you offer something called the plant-based gut master method. Because if you're like, yeah, 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 but I don't know, like, I don't have a GI who's, like, helpful, or can't find, like, a really good gut dietitian. Well, Ayten's a really good gut dietitian, so tell us about this program.
Thank you so much for saying that. Okay, so this program I designed, and I just have to say too that it's so funny that you say you don't feel like you need to figure out all of this stuff on your own, because I think also part of what triggered me to like very much go down the path of becoming a GI dietitian was like I have to figure all of this stuff out, like everybody. Oh my gosh. I mean, and all of my patients can relate to the experience of like, okay, yeah, I'm gonna DIY this like elimination diet at home and see how that goes for me. And then they're like, I feel a little better for like 3 weeks, and then it comes back so much worse or whatever it is, because we're not actually getting to the root. Then maybe you feel like you have to avoid plant foods entirely and you cut them out and things get worse from there. So I developed this program to kind of put in one place all of the personalization that I felt was really difficult to find on what steps do I need to be taking in order to improve my digestion while eating foods that I actually enjoy. I'm Turkish. I love food. Like I love spices, I love fresh herbs, I love colorful plates. Like that stuff is really important to me. And so, I mean, one of the biggest things that I feel like I lost out on when I was trying to figure out what was going on with my gut was flavor, and I missed it. So, I mean, for people who are dealing with IBS and SIBO, you do not have to sacrifice flavor to get your symptoms under control. So the plant-based gut master method comes in. It's well, we can do the special announcement like the you hear it here first people thing. Right now, I offer a 16-week one-to-one high-touch program where I help patients who have IBS or SIBO to resolve their symptoms, expand their diet, and actually enjoy the foods that they're eating and incorporate more plant foods back into their diet. Most of my patients, you don't have to be vegan, you don't have to be vegetarian, but most of my patients want to get plants back into their diet, and they've been avoiding them for fear of symptoms for a really long time. They're not feeling good as a result of it. So that's predominantly, the people that I see. And I am announcing here a new version of my program that I'm going to be launching in 2023, which is going to be a hybrid version. So if you're for somebody who benefits from having a little bit more of a group environment and hearing from others who are kind of going through what you're going through, and you are more of like a self-paced kind of person, like you want to check in with me a few times, but you still want to have materials that you can work through on your own and your own pace. That is going to be the hybrid version of the plant-based gut master method, and I'll be launching that in 2023. And I'm super, super, super excited about it because I know that's going to be accessible for people. And for the introverts out there, I feel you. I am also an introvert. So sometimes it's nice to have your course materials. Desiree's raising her hand too. To have like an online course you could do in your own time while checking in with a clinician who is like, this is all that I do. All I do is GI nutrition with a plant focus. So
Yeah.
if that appeals to you, I would love to help you. You don't have to be eating nasty food.
Oh my gosh. Yeah. And that was a big thing for me with good for your gut. I was like, I don't understand why taking care of yourself is supposed to taste like awful sadness.
Oh God, it doesn't have to. No, it doesn't have to. That's why it made me so sad when I was, sometimes I'll check out those like SIBO chat boards. Oh my God, how old am I? They're not chat boards. It's a Facebook group, like
Yeah.
Facebook groups. Where they're talking about like different types of things that you should be eating or not eating, whatever, and it's just plain meat. And I'm like, whoa, no, there's so much more we could be incorporating in your diet. You could have those beautiful, colorful plates and cultural foods that have meaning for you. And one of my favorite things that I like to chat about with patients is like, what's the kind of food that you grew up eating? Like, let's get some of that emotional, like memory satisfaction out of our food too, because that is an important part of food being a tool for your health, right?
Yeah. Well, I mean, even like when we're talking about the gut, we're talking about the deep gut brain connection. And when you eliminate a sense of joy and pleasure, like that has a physiological effect on your body. Like food is such an opportunity. It's such an opportunity. Even in like the worst day, you can have a really great dinner and you're like, oh, thank you. Like this
Yeah.
was this beautiful bright spot in my day because I just had an absolutely delicious dinner.
Yeah, absolutely. And I'm sure you've heard people too say that, if they were fortunate and had a really nice upbringing or something like that, sometimes when people go back home, they say they have the best bowel movements that they've had in a really long time, right? Because you're having maybe, and part of that could be the nostalgia of having foods that you grew up with,
Yeah.
being in an environment that hopefully, fortunately, was comfortable and safe. And those kinds of things really do play a role in our experience and quality of digestion. So, really, the question is, what are the strategies that are evidence based that we know can help you to create that sense of physiologic, psychologic safety and optimization for digestion? What does that look like for you? Maybe
Yeah.
what looks like for you, Desiree, is different from what it looks like for me. And what I need is different from what the next person needs. So it really is an individual process of finding harmonization, again, between
Yeah.
the gut and the brain and what works for your body and getting on the same page and having fun with it, like being
Totally.
curious about what it is instead of like, oh, no, I got to cut this out and this didn't work.
Yeah.
And I totally get it's so easy to get frustrated with it all because when you feel like you've tried everything and you're not getting the results, it can be really difficult.
Yeah, absolutely. And, for so many clients, over like the decade of practice, it's like it is about learning to trust again and building this relationship back up with your body where we're like, oh, no, okay, we are on the same side. And when it can become a really gratifying, grounding process to go through something like this. And so I just hope that like everyone who ever has issues with their gut can find someone like you because like we need it. We so desperately like our guts
My
all not
goodness.
well in our shire and like we need more help now than ever before. So I will make sure to post to your website, like get on her newsletter, get on her Instagram so you'll know when these things are happening. And I close every episode with some rapid fire questions.
Oh,
Uh,
fun. Okay.
I do not tell the guests in advance, but they're like softballs. They're fun.
Okay, cool.
So first one is the best book you've read so far this year or audiobook.
Oh my God, that's so tough. I um I read The Body Keeps the Score, and
Ooh.
that's such a good one. Highly recommend, especially to GI people. You will love that one. Yeah.
Yeah, I will definitely link to that because I feel like anyone going through something chronic, it's a very, very good book to read.
It's really good. It's really empowering also. I mean, it's a ride, but it is you feel empowered. Okay, things are
Yeah.
making sense. Yeah, check that out.
Yeah, Dr. Mate has a new book out this year too. I might
Ooh,
link that one too. Yeah, there's a new one out right now. Okay, sweet or savory? You only get to pick one.
savory, hands down. Oh my God. Like a messy, saucy something, probably from a food truck, which by the way would not have been an answer that I could have said 10 years ago, but now can because I have helped my digestion. Yeah, and found help. Savory, 100%. Can you
Me
answer
too.
that too? You're savory? Yeah.
Oh yeah, like leave me alone with a jar of olives. I'm done. Like I'm good.
Yeah. Oh yeah. Oh
Party of one.
yeah.
All I
Yeah.
need.
So
Uh,
good.
okay, secret talents.
Oh my God, secret talents? That's a tough one. Are you able to like say things that you're talented about? I get like shy about them. Like I don't know. It's a secret because it's a secret.
Yeah,
I I love painting. I actually really love
that's
like drawing and
amazing.
painting and yeah, it's something that I'm like I need to when I find pockets of time to do it, I feel so joyful doing it and it's something I used to do a lot more. So maybe you're inspiring me to get back in the habit.
That's incredible. 3 out of the 4 members of my family are deeply artistic. I am the one that is not. Like, words and food are, like, my method of creativity because I still draw stick people like I'm 4 years old. And even
Okay,
my
yeah, but when you're
7-year-old, she's like,
cooking,
yeah,
that's oh my God, brilliant, genius. And I get it because both of my brothers are like very musically talented, like very, and engineers. And I'm like, what happened? Why don't I? Where is that for me?
Next place you want to travel?
Ooh, um, hmm. I have been wanting to go to the cenotes in Mexico, like near Oaxaca,
Mhm.
um, for a very long time. I would love to get out there. Also, the
Mexico's
food.
yeah. Mexico is such an incredible country, and it is so massive that I feel like you could spend an entire lifetime, like, trying to see every little pocket.
Totally. Yeah. So we're right now in Southern California. So we can get into like Baja, Ensenada in like 3 hours, but we want to go like further south and do some more exploring and like the caves and just, oof, it's so cool. And also just like Oaxacan food. I just can't. You're probably somebody who also does this, but like I like look up like the chefs and like where they are in their restaurants and I geek out and I get the reservation and I like, do you do that too?
I choose the restaurants before I choose the hotel because I need a hotel that's not too far away from all the good restaurants.
Same, same. It's like, why do I don't want to be 45 minutes away from the main attraction. It's all about the food.
Yeah. It's like, let me see all your photos of this incredible place. I was like, well, here's what I ate for breakfast. And here's
Yeah,
what I
yeah, exactly. Oh my God, my entire camera reel is like, this was breakfast, this was lunch, this was a nice coffee that I had. Oh yeah, here's the beach.
Yeah. I pepper a couple of like kid shots in there. I have to. I'm a mom, but like other than that, it's all
Right, yeah,
food.
true. Yeah, I guess, yeah. Obligatory. Like, oh yeah, they were there
Yeah.
too.
Okay. Last one. So, a piece of advice that you give others that you're still working on yourself.
I am you know what I should have said for my secret talent is telling on myself because
Oh,
I like if I'm doing something, I like have to tell somebody that I'm doing it. So one, as the GI dietitian, you're always telling people to get on a pretty consistent eating schedule, right? The thing that I have struggled with my whole life is getting on board with breakfast. Like I love breakfast foods, they're great, but I just cannot. Like, there are some times where I get off schedule and I'm like, ooh, it's 3 o'clock. I should really eat something today, or getting on a regular eating schedule is something that I fall off of sometimes, and I have to get back on. And I will share an exercise that I do. that I also share with my clients, like when I'm going off the rails there, because you'll feel it. You'll feel it in other, you'll feel low energy. You'll feel like your GI symptoms are kicking back in. Like you mentioned, when your IBS comes peekabooing back in, my symptoms come back in when I'm getting off with my eating schedule. So one thing that I recommend is for people to get really in tune with what their experience of hunger looks, feels like. Because maybe your experience of hunger is different from the next person's experience. So, or maybe you're only registering hunger really far down to the point that it's a very strong physiological cue, when really there were some psychological cues that we could have dialed into a little earlier on that can help you to prevent that energy slump. So, what does hunger feel like for you? Is it thinking about food a lot? Are you thinking about that really yummy thing that you ate, a couple of days ago? Are you thinking about what you're going to have for dinner tonight? Are you thinking about what's in the pantry? Then you get overwhelmed by having to go to the pantry and go actually like make something. Or are you feeling that like growly thing in your stomach, which passes really fast, by the way? So if that cue passes you by, maybe you're starting to get kind of sleepy. Maybe you're starting to get kind of irritable. Maybe you're starting to get kind of headachy. So that's kind of a spectrum of the symptoms. And you really want to try to respond to those cues earlier on when you're noticing that you're starting to think about food. So that's something that I do for myself. And then on the flip side, what does satiety feel like? So it's all again about that creating that harmony and awareness to our internal cues and responding to them to let your body know, like, message received. I'm going to go do what you need now so that you feel more safe. You like are in a physiologic situation where you have resources to get. You can go have a snack. Just go grab a snack, or you can go have some water. So that's something that I frequently have to go back to as a cereal breakfast skipper.
Yeah. I
Yeah.
love that. And I love that idea of, really asking yourself what hunger is for you, and the idea that, our body has needs, and we so love to pretend we are literally just disembodied brains working
Yes.
24/7, but we have a physical vessel.
Yeah, we have a habitus. We have to
Yeah.
do things for it. I
Yeah,
know.
and it's not just like, worthy of a little bit of care and attention, but it should be our priority. Our world is not set up for it to be our priority as much as it should. But like whenever we can be like, no, I'm the priority again. Like this physical body is the priority again. Like it's such a
Yeah.
powerful tool.
It truly is. I love that too. And it's so strange that it feels like a rebellion to say, like, okay, I'm going to go take a walk at lunchtime, or like, I'm going to go have a snack instead of just powering through this note right now, but
Totally.
it really is. Yeah. And it's a very powerful tool for us to just feel better, feel more aligned, and actually develop a stronger connection with what it is that our body is asking of us in that moment, and knowing how to respond to it.
Yeah. And it will bring us like so much comfort and
Yes.
like, yeah, it's just it's what needs to happen. Like we're so good at ignoring our bodies, and our bodies really need us, particularly when something is going wrong with our gut.
Yeah, absolutely.
Thank you so much. I did this conversation. I mean, like it was so deliciously nerdy and all the things. And I just think it will give everyone a really great perspective on the complexity of this, so that the next time they're getting like hit with this like post, it's like, stop doing this for SIBO. That's probably not based on any evidence whatsoever. They can go back. They're like, no, no, no. It's a lot more complex than this. I'm going to stay the course.
Yeah, absolutely. Desiree, I could talk to you for hours and hours and hours, and we should totally do this again.
Yes.
And you bring up a great closing point, which is, if you're seeing stuff that's telling you what not to do or what not to eat, if you have SIBO, red flag, red flag, red flag, red flag. The practitioners who really know what they're talking about are going to help you focus on expansion, curiosity, and inclusion, and not what to cut out to make your life more empty. We want you to be feeling full and happy and nourished. So keep an eye out for that stuff. And anytime you want to do this again, I'm game. This was so